Again, David Baum, our PSN board member and longtime health advocate, is doing today's presentation. If you were with us in 2022, David did a similar presentation about PERS, which you'll learn what PERS is in just a few minutes. But we're so thankful, David, that you're sharing your wealth of knowledge about how we can prepare and hopefully prevent any kind of medical emergency. So thank you so much for doing that for us today.
Thank you, Angela. I'm sharing a screen. Can everybody see it?
Yes.
Okay. What I would ask one of our co-hosts to do is to mute everybody.
We'll do, David. Yeah, I'm gonna do that right now. So, and then I'll unmute you. So, all right. Oh, David, go ahead and unmute yourself. I think you're still muted.
Yeah, there I go.
Okay.
All right. Preparing for and preventing medical emergencies was a topic that many people had expressed an interest in having us talk about. We did last year, or I guess it was in 2022, we talked about one of the things that you could do. Today's presentation is basically designed to help you understand how to prevent a medical emergency or to mitigate the impact. For the purposes of today's presentation, we're going to define a medical emergency rather narrowly as an urgent situation that presents a risk to life. Medical emergencies can typically be avoided through planning, education, and implementing certain protocols. Now, where we can take action to prevent medical emergencies is, one, we can provide a personal emergency response tool. Two, we can do some advanced coordination with first responders. Is the slide not advancing? Sorry.
Oh, there you go.
Okay. We can prepare proper documentation of our medical conditions and our medications and the appropriate schedule. And we can also take very proactive steps to advocate with physicians and hospitals. So let's first talk about personal emergency response tools. PERS, it shows up as PERS or P.E.R.S. They're personal emergency response systems. They have been around for a while. They were originally created as a tool for people who were homebound to summon assistance in the event something unforeseen happened. Somebody who had had a fall might have been alone or might not have been near the person who's caring for them when they had a fall, or they have symptoms of a medical emergency. There are different kinds of PERS. As technology evolved, the original instantiation expanded. Different hardwares were developed, and base stations and signaling devices evolved at that time. You have two types of services. You have a central station service, or you have a service that calls a designated family member. The components of a PERS system consist of a signaling device, which is something that the patient uses. It can be a pendant. It can be a button on a wristband. It can be a pull station in the bathroom or a button in a bathroom. Another important component of a PERS is the base station. It's a device typically in home. It's designed to recognize the signal from the signaling device, and it calls the central station, or it could call a family member. Central stations are central locations that are staffed 7/24. They're designed to receive calls from base stations, and if it's a two-way PERS device, they try and communicate with the patient. either through the speaker and microphone on the base station in the patient's home, or if it's a two-way signaling device, through the actual signaling device. The central station is responsible for calling the appropriate first responder agency based on the nature of the emergency. The three types of PERS systems that are out there today are your basic in-homes, a base station PERS, an in-home base station PERS with two-way signaling devices, or the newest devices, which are out-of-home devices that use cellular technology to allow you to have the benefits of a PERS system when you're not in your home. These are increasingly becoming the most popular. And as battery technology improves, they're even more popular. Your basic in-home system, as I said, is connected to the phone line to communicate with the central station. It's limited in range to be within your home or it's slightly outside the home. You may get coverage in the garden, for example. And it requires that a patient be able to speak loud enough for the base station microphone to hear them. That's why the basic in-home PERS is not always the best system for an individual with Parkinson's disease because they are not necessarily able to speak loud enough to be heard by the base station. You have an in-home base station with two-way signaling. The base station still connects with the phone line. The range is limited to inside the home, but the signaling device, the pendant or the wristband, has two-way communications with the base station. So a person with Parkinson's would be able to be heard and communicate with the central station operator. And then you have the out-of-home devices that don't require a base station inside the house. They're totally dependent on cellular coverage to provide service, and they provide two-way communication between the patient and the central station. As PERS systems evolved, supplementary services were added. These included fall detection circuitry in the patient signaling device to detect that a patient has fallen down. They are smart enough to know that the patient has fallen down as opposed to just lie down in bed. They have geographic location monitoring, which requires GPS. These are typically in the cellular out-of-home devices because cellular devices are already equipped with GPS. They also have expanded the role of the central station from calling not only the first responder agency, but calling one or more designated family members so that the family knows that somebody has been reported to a first responder organization as needing assistance. They also have now added a service where you can sign up to have the central station check in with the patient proactively by calling them on the phone to make sure that they're okay. When you're choosing a personal emergency response system, there are a number of things that you need to consider. Is cognitive impairment an issue? Is the patient capable of being relied upon to activate the signaling device? Is the patient a fall risk? In other words, should you be certain that the PERS that you get includes a fall detector circuit? Can the patient even set up the device? Some of the service providers do the setup while others just ship it to you. So you have to know whether or not you're going to be capable of doing that. And who services the device if it breaks, if there's a failure? How long does it take? Is the service company available 7 days a week to take and make a service call? Are loaner devices available while something is being serviced? Does the PERS seller use their own central station or is it contracted out? How qualified are the central station attendants? Are they trained in first aid to recognize the problem and talk to you while first responders have been summoned? How long has the PERS company been in business? Whoops, heavy finger. Another one is, are the signaling devices waterproof? If you have some of the earlier pendants or wristbands, they were not particularly waterproof and were prone to breaking. Now they have waterproof signaling devices that are mounted on shower walls at a lower height, so that if you fall in the shower, you can reach them and push the big button, almost 2 inches in diameter, to call for help. I just spoke about the separate signaling device. And does the patient have a hearing limitation that would prevent them from effectively communicating on a two-way device? Before we move on to the next step, if anyone has any questions about PERS systems, you can put them in the chat. You can raise your hand. Angela will recognize you and forward your question.
Thanks, David. And so far, no questions in the chat. And I do want to remind everyone, if you're frantically writing, you may be reassured that we're going to post these slides on the web on our website. And I put that link in the chat as well, but we'll also send it out to you later.
Okay, we'll move on to the next area of action that we can take. And this is doing advanced coordination with first responder agencies. There are different ways to achieve this goal of advanced coordination. One is to enroll in a disabled resident registration program. These are programs that are offered by various agencies. We'll talk more about them in a second. Another is to enable first responder agencies to have rapid or enhanced access to your home. Some people call them lock boxes. There are various things related to that we'll talk about. You can also obtain from first responder agencies a specialized door or window decals to alert a responder when they get to a home that there is someone inside that needs special help. And finally, there is first responder orientation, which is not offered by everybody, but we will talk a little bit about that. The disabled resident registration, it's a terrible name, but I couldn't think of anything generic enough because every county or city has this kind of a program calls it by a different name. Basically, these are efforts by a municipal agency to allow people who have medical conditions or special needs to enable them to register these needs with the first responder organization, so that when a first responder is dispatched on their computer screen in the fire truck or the ambulance, it identifies by address that there is someone in that house that needs special assistance and what that is. In the case of amputees, for example, they typically show where in the house the individual who is an amputee, where is their bedroom, so the first responders know where to go to. It also will let them know, first responders know, if somebody is deaf, if somebody has difficulty communicating, if someone has Parkinson's disease, if there's somebody with Alzheimer's living in the house. Now, I've put two hyperlinks in this particular presentation. One is for the Fairfax County, Virginia program. You can enroll online by going to that hyperlink. You can also get all kinds of information. There's a video that talks about how that program works. I've also put down the Arlington County program, which is known as Emergency Triage, Treat, and Transport, or ET3. If you go to that link, it gives you the information about the program, how you can enroll, who you can call for additional information. When you get the paper versions, the downloaded versions of this presentation, these hyperlinks will be active, and you will be able to click on them to take you to these specific locations. I only printed the Fairfax and Arlington County program information because they were the first to provide these programs. Almost every major county or city has some program of one form or another. And to find out about whether or not your organization is covered, the best thing you can do is either call the non-emergency number of the Public Safety Communication Center, or call your local fire station, because fire and EMS are the ones who are most dependent on this program, and they're very well versed on how it works and how you can take advantage of it. Rapid or enhanced access is something that many people have been doing for quite some time. The most simple form is to obtain a lockbox and put it on the front door and provide the first responder agency with the combination. You leave a key to your home inside of it. If fire or EMS is dispatched, they're given the combination by the dispatcher because you've registered it, and it allows them to get to the key and get inside the house. So if somebody is administering CPR, they don't have to take away from CPR to go down and answer the door. Or if you're alone in the house, fire and EMS can get in and get to you. You may have heard the term Knox box. Knox box is the name of a proprietary product. It was originally implemented for commercial buildings. You've probably seen a Knox box and not known what it is. It's a square box that's brown and black, and it has a red cover over a keyhole. And what that is it's a requirement when you build a commercial building now that you put the building master key in the box, and the fire department, the officers on the trucks have a key that will open all the Knox boxes in a given county or city. And that way the fire department can get at the keys to the building and can get in and fight the fire, or the rescue services can get into the building. Knox box has now been made available for you to get for your private residences. They are more expensive than your typical lockbox, but they don't involve you having to register a combination of a lockbox. You don't have to go out and buy the lockbox. The Knox boxes can be hung on your door, or they can be permanently mounted on your building. The local fire department will show you how to take care of that and arrange for a Knox box. The door and window decal program are one of the oldest programs for advanced first responder coordination.
Hey, David.
Yes.
Before you go forward, sorry, we do have a question from Marie. She wanted to know, she said, we live in Arlington near the Alexandria city's line. Our ERT services are provided by Alexandria. How and where should we register?
With Alexandria, with the entity that provides the service. If for some reason, the metropolitan DC area has one of the best interagency coordination systems in the country. When somebody is dispatched from an adjacent agency, the information that you may have provided to your home agency is provided to the dispatched agency, so they will get the same information. So even though Alexandria is your primary, and that's who you should register with, if for some reason the Alexandria trucks or ambulances were not available and Arlington was dispatched, they would get the information, but you register with Alexandria. Any other questions?
No, that's it right now.
Okay. The window and decal program, as I said, is the oldest program around. It was created by emergency fire and rescue services many, 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 many years ago to give them a heads up that there is someone inside that needed special help. And basically, you get the decals from the fire station. Sometimes they mail them to you, and you put them on the entry doors or the windows adjacent to the entry, most adjacent to the entry doors. They're usually spotted by firefighters or rescue personnel. As I said, because this program is so old, it's not as popular anymore as the advanced registration, because that information is guaranteed to show up on the computer screen in the fire truck or the computer screen in the ambulance that is being dispatched. Finally, you have what's called first responder orientation. And it's important to note that not all agencies will offer this. Fairfax County does in most stations, and I believe Alexandria and Arlington do as well. If you have a very special need, it gives you the opportunity to call the local fire station, the non-emergency number, to your local fire station and explain what the situation is and offer to arrange to have a representative from the station visit your home and talk about the needs and see what the special circumstances might be. This is not like I said, it's not available everywhere. And the risk in only doing this is that while one shift may know, i.e. the shift who came out and visited you, there's not a guarantee that sufficient information gets passed on to the next shift personnel. So your best bet is to follow the registration process that I talked about before. But even if you've done the registration process, this is an additional step that you might find useful because in the visit, the fire or EMS staff may offer you some additional suggestions that we haven't talked about that will help them do their job and that will help you stay safe given your condition.
David, we have a comment in the chat from Robert. He said, do not count on the local fire station to have the information about registering special needs. I live in Fairfax County. I got an annoying runaround and was not given the site that you just mentioned.
Well, then I would report that because every fire station is supposed to know about the program. And you can call the county executive. There's a deputy county executive for public safety services. You can call his office and report that, or you can report it to the office of the fire chief, because the registration program is a well-documented program that's been around for more than 20 years. When I volunteered with Fairfax County, it had a different name, and every fire station was told about it, and every police station was told about it. So I'm sorry to hear that you've had that problem.
Robert, do you want to add to that?
Yeah, let me just tell you what happened. I called and they referred me to another number. I called them and they said I explained my wife had Parkinson's and that they might need help, in case of a fire. That she would need assistance because we're on the 11th floor and the elevator is shut down. And they said, "Oh no, call when there's a fire because a different fire department might respond, and therefore the local fire department would not have the information." So they told me to call in the event of an emergency of a fire, so that the dispatcher could tell the responding fire unit that my wife was injured.
Do you live on, do you live on
I'm not questioning you, David. I'm just telling you, I'm just giving you some background as to the BS I got when trying to do this.
Well, I'm sorry that you had that problem, Robert. I can tell you that letting them know by calling at the time is always like belt and suspenders. But the fact of the matter is that once you're registered, it's automatic. It doesn't depend on a human being. It gets included in the dispatch instructions to the truck.
Oh, and I appreciate that. I'm just letting you know, or letting everyone else know that until I saw your site information, I had given up. So I appreciate it.
And I appreciate your feedback. Okay. The next step that we can take affirmative action on our part is documenting medical conditions and medication. It's not something that most Parkinsonians or their care partners don't know because they are, for the most part, accustomed to making appropriate documentation. There are various ways, however, of documenting medical conditions and medication. The most important, and the one to do regardless of whether you do any of the other three, is to make your own self-prepared listing. In addition to that, there is the Vial of Life program, which has been around for probably 20 years, Medical Alert, which has been around for almost 75 years, or the First Responder Health Profile, which is offered in some counties and cities. So let's talk about these. Self-prepared listings are the most effective and the most important thing for someone with Parkinson's disease to have in their possession, for their care partner to have in their possession, and for an outside family member to have a copy. It should have a list of all of your medical conditions, including those that have been resolved. For example, if you had a hernia and it's been repaired, or you've had cataracts and they've been taken care of and intraocular lenses have been implanted, these should be listed and their status should be listed. You should list any implanted device, a DBS device, a Duopa device, a pacemaker, a defibrillator, pardon the spelling error, implanted lenses after cataract surgery, if you have a stent, if you have mechanical joints, all of these should be listed. Then there are 2 medication lists that should be included in this document. One should be a list of all medications in alphabetical order. This list in alphabetical order is critical for verification if they're going to give you another medication that there is no contraindications. That's why an alphabetical listing is critical. And the second medication list should be in chronological order, which should list each medication, the dose, and the time at which that medication is to be administered. And this is critical because you need to make sure that wherever you're going, in an ambulance, if they're taking you to a hospital, or if you're going to a doctor's office, that they know what you take, how much you take, and when you take it. Now, again, this self-prepared listing is something you should have regardless of whether you make use of the next 3 tools. The Vial of Life program was a nationwide program that started many years ago, I think almost 30 years ago, if I remember correctly. It involved the placing of a special decal on your entrance door, or the window by your entrance door, to let a first responder know that there's a comprehensive set of medical information located on the refrigerator in the kitchen. Under the program, and the instructions in the form are shown, that link that is shown in this slide will be active in the paper copy that you download so that you can go right to the program. There is a form that it gives you, but it is not enough for the average Parkinsonian, and therefore the form, although you fill the Vial of Life form out, you must attach your self-prepared list to it. And as the instructions show, you're supposed to take either the bag the program supplies, if your area provides bags, or you take a Ziploc type bag, you put the folded over form at the very front so it'll show the Vial of Life symbol, and then you tape it to the refrigerator. Now, many years ago, they had a magnetic holder. They don't offer those anymore. You're now dependent on using a Ziploc type bag and taping it to the refrigerator. Your care partner should know to tell any EMS person responding that there is a Vial of Life package on the refrigerator, or your care partner should take it off the refrigerator and hand it to the responding EMS personnel. Again, supplement the standard form that you get to at that link with the self-prepared list. There is also the Medical Alert program, and it's important for me to point out the Medical Alert program is entirely different from TV advertisements you see for Medical Alert, which is a company trying to sell you PERS systems. Medical Alert is a charity that was established almost 75 years ago, and its mission for its paid members, yes, there is a fee, to provide a repository with medical information that's available 7/24 for authorized emergency and medical personnel to be able to get at the medical history of the member. You are responsible for providing Medical Alert with all of the medical details for them to put in the computer. Again, you should work with your self-prepared list and you talk online to a Medical Alert representative who is knowledgeable in what things need to be recorded. Medical Alert members will typically wear specialized identification devices. Most frequently seen is the sterling silver stainless steel Medical Alert bracelet that has the red caduceus symbol, and on the back side engraved is your name. Certain critical information used to be engraved in the old Medical Alert bracelets. They've stopped that process now simply because it's too hard to know which is most important in each individual case, and they've replaced it with a QR code. So the EMS person responding will scan it with their cell phone, and it will show your medical file. It's the most rapid way of getting to your medical information. They also have new wallet cards. The old wallet cards used to list all your medical conditions. The new wallet cards list certain information about you, your name, date of birth, your blood type, if it's known. And it has the QR code again, so the hospital or the ambulance attendant scans it with a cell phone and immediately sees your entire medical record. In the case of the hospital, though, most of the time they go to a browser, they go to the Medical Alert webpage, and they enter your Medical Alert number and their hospital ID number, and your medical information comes up. I have put the URL link to get to Medical Alert in the document. It will be a live link when you download the paper document, and you can click on it and you can get directly to Medical Alert so that you can decide whether this program is for you, and if so, to join it. I can tell you, I've been a member for more than 40 years. And I carry a neck chain. Sometimes I wear the bracelet, and sometimes it's just on my keychain and it's in my wallet. The first responder health profile is similar to the registration of a disabled resident. This is a program where the fire and EMS organizations have arranged with the Public Safety Communications Organization to create a medical profile so that it's more than just saying that there is a disabled resident and what the nature of the disability is. It provides critical medical information so that the first responding ambulance or EMS personnel will have. It is not offered everywhere. The last time I looked, it was offered in Fairfax and Arlington as part of their enhanced 911 capabilities. And the amount of information is limited, and it's only the most critical information that needs to be put in. Different places around the country allow you to also submit your self-prepared listing. They will scan it and put it in the system, and it will pop up as a PDF on the screens in the fire trucks and the ambulances. Again, this is separate from typically the disabled resident registration. In some cases, It may be combined. It's not always offered while even in places where the disabled resident registration is available.
David, Angela has her hand up if you can take a break to answer.
Yep.
Yeah, David, I just wanted to read a comment that Ed had put in the chat. He said Marie had this list of meds, gave it to the hospital staff upon admittance. They refused to give her Rytari and would not let me bring her meds into the hospital. Terrible experience.
Let me address that in the section on advocating with physicians and hospitals.
Perfect timing.
Right. Advocating with doctors and hospitals. Yeah, the healthcare system today is less than optimum for really sick people. It's great if you're not tremendously sick, but people who have Parkinson's disease have a unique problem, and that is the criticality of the timely dose of medication. Unfortunately, today's hospital systems are designed to provide nurses with a 2-hour window within which medications may be delivered and given. Because typically in a hospital floor, a single nurse is charged with all medications for the floor. If the floor has multiple wings, it might be a single nurse for each wing. And therefore, that individual has medication responsibility for upwards of 20 people. And they start at one end and go to the other because hospital procedures do not recognize the criticality of getting a Parkinsonian patient their proper dosage at the proper time. You have to do the advocating either as somebody with Parkinson's or the care partner that accompanies them. You have to be a nudge. I don't know any other way to say it. You have to be a pain in the ass and bother the hospital staff to make sure they understand and get this point. And if necessary, if you're not getting the proper attention, every hospital has a patient advocate, and many hospitals have a program where they have a rapid response staff member come because you don't feel that you're getting the appropriate and timely treatment. Different hospitals call these by different codes, but they are required to identify that this particular program exists in their patient handbook, and they are supposed to have them up on the walls. Bring your lists. Yes, you can bring your medications. Every hospital has its own rules as to whether or not you are allowed to bring medications into the emergency department or into the hospital. This is an unfortunate consequence of those horrible people known as lawyers, because lawyers love to sue, and hospitals don't want to take the responsibility for somebody getting a medication that the hospital did not administer or is unaware of, in which case the hospital may administer a duplicate medication or a contraindicated medication. The first thing to do when you're being seen in an emergency department or in a hospital is get your list out, tell them you're a Parkinsonian, tell them the criticality of the timing. If you're due for a medication, tell them that you either have it with you, if you have kept it a secret, or they need to get it to you. The problem with getting it from the hospital is that if the medication isn't listed in the orders when you are admitted, it can take an hour to get it out of the pharmacy after the fact. If you have a hospital that you routinely go to, one of the things to do is to make sure that your medical record is flagged with the appropriate code that you have Parkinson's disease. I'm not talking about it being in your medical record where your diseases are listed. I'm talking about a flag. The medical record system in the Inova hospital system, in Virginia hospital system, are a program called Epic. And Epic has the ability to have a red flag start blinking when your medical record is brought up that you have Parkinson's disease. So you want to make sure that that flag is set in your medical health record. And you do that by having your physician arrange with the medical records department of the hospital, or you call in advance to the medical records department of the hospital and ask them to be sure to set an urgent flag to call attention to the fact that you have Parkinson's disease.
Hey, David, Ed has his hand up. There may be a follow-up. Did you have?
Yeah. You know, we did all that. And the reason I asked earlier about registering with the EMTs is that we live very close to Inova Alexandria. I will never, ever take my wife to Inova Alexandria. Now, when the EMTs come, they're dispatched to take you there. And I don't know how we overcome that problem. That hospital treated us terribly. I was not allowed to give her Rytary. Then they had the nerve to say she was regressing, and she had to stay longer. I said, I'm taking her out against medical. I said, get me a wheelchair now. We're leaving. So we left, and she took her meds, but I never want. And I wrote to the hospital, and they ignored my writing. And I gave them the identification of the nurse that was totally. That nurse should never deal with people. That's how bad she is.
Ed, your personal experience is important to know. This isn't really the forum to do that, but if you contact us directly, I will give you the name and phone number of the person in charge of patient experience for the entire Inova system. And I guarantee this individual is not going to ignore your feedback.
All right, that would be good. How do I get that again? What do I do?
Just call the Parkinson Social Network telephone number. It's 571-286-5000.
Thank you.
We've got another hand from Robert. Robert, do you want to go ahead? Oh, you're muted, dear. Sorry.
Recently I had to take Shirley into the emergency room, and I took her. She has specialty Parkinson's medicines such as Rytary and Nuriance, and I knew in advance the hospital would not have that medicine. I was told this already, so I brought it with me, but I did not have a problem. I explained to the ER doc that she was a Parkinson's patient and that I wanted to administer the medicine at the time, and I got no grief. But if you have specialty Parkinson's medicines, I certainly recommend you bring them because a lot of hospitals do not have it.
Thank you. That's a very good suggestion.
That we didn't have any other
We
questions in
did
the
bring
chat.
the meds. We were denied.
Okay. There is a very excellent publication from the Parkinson's Foundation called the Hospital Safety Guide. It's a booklet. It's a source of information, and it is also a source of forms, sample forms that you can fill out. Again, if you use these forms, attach your own self-prepared form to it. It has identification cards that you can fill out and keep in your wallet. For example, to tell somebody that in the case a police officer thinks you're inebriated, you can hand them the card that says you have Parkinson's disease, you're not inebriated. Or if you have severe dyskinesia, obviously it's going to be difficult to hand them the card, but you can tell them to look in your wallet. it is an extraordinary publication, well worth going to the website at the link that will be in the document you'll receive. I recommend that you order online to have a copy sent to you, because then it's printed on the special paper in the form that they deliver it. But if all you want is the forms, you can download the entire booklet and read it, and you can order it online so that you will know everything that you want to do with it once it comes. They spent a lot of time. It's very obvious from how well this document is put together. I can't overemphasize the fact that everyone should order a copy of it. So in summary, what we have talked about today in preparing for and preventing medical emergencies is: 1, providing a personal emergency response tool; 2, advanced coordination with first responders; 3, properly documenting your medical conditions and your medications, both by name and alphabetical order, and by time of day and dosage; and then advance advocating with physicians and hospitals. And if anyone has any questions that we haven't addressed yet, I'm happy to address them now.
And I'll ask everybody to unmute themselves and join the conversation. Thank you, David, so much. That is so thorough. I know it's somewhat overwhelming at the same time, but
Well, that's one of the reasons that we want everybody to get a copy of the slides, download a copy of the slides, and print them for them to be able to read them at their leisure.
yeah, and I want to follow up with what Robert and Ed said about the hospitals. I had experience with not here in Virginia, but for my mother in another state, and I will tell you, the continuity is especially if you're dealing with different hospital systems. There really is very little continuity when you're dealing with each one. Unfortunately, you have to kind of meet them where they're at and tailor your approach based on the hospital. I wish it were, the same procedures for every hospital. Unfortunately, it's not. So I'm not trying to reassure. I'm just trying to add to the commentary. It can be extremely frustrating, and I feel both of your frustration when it comes to that situation. It is difficult, unfortunately.
Yeah, I think one of the things that's very
Mark has
challenging.
her hand up. Excuse me.
Oh, sorry. Thank you. We're about to take a 3-week international trip, and I'm guessing all I can do is everything that you said here, and every country is going to have a different response to medical issues if I need to have anything done. Do you have any advice for that?
Well, 1, take your medications in their original containers that have the pharmacy label on them. If that's not practical, go to your pharmacist and ask them to print you a duplicate set of labels, put the labels on paper, and carry the paper with the pharmacy labels with you. But it's always best when you travel internationally to carry the original medication bottle.
Right.
I would warn you, there are some countries where certain medications are in fact prohibited.
Yep.
And they can be confiscated at the border. So what you need to do is you need to check based on the country with the embassy of that country, or online. I think the State Department had some resources about prohibited medications for each of the countries. Now, I am unaware, but I cannot guarantee you that medicines for Parkinsonians are on any of the prohibited lists. But if, because of Parkinsonian-related symptoms, you take certain antidepressants, certain anti-anxiety medications, these are among the medications that are on prohibited lists. So you may have to get your physician to give you a non-prohibited medication.
Oh, that's interesting. I wouldn't have thought of that because I do take one of those. Okay, thank you very much.
You're welcome, Ashley.
Angela, did you have any personal experience from when you all were overseas last year?
Um, yeah, I did what David said, we both had medication lists and doctor information with us. I also I don't normally do it here in the States, but I made sure that I had backup meds in my bag. I did not carry the bottles since Carl had the bottles. I did what David did is I took a label off and I had it all ready to go. So in case of something happened with that bag or whatever, or if we needed an emergency dose, I had it too. But I made sure to have his labels because I didn't want them to think that I was carrying medicine that wasn't prescribed to me.
Mm,
So that was important for me to have those as well. Um, I the only experience I had was I went to the went to the emergency room for a respiratory thing in the UK, and it was an 8 to 12 hour wait to see a doc.
oh my gosh.
And I said, well, I guess I'm not going to see a doc in the UK. And that later that day, I had a flight to Switzerland. I masked up, I made double masked, and I got on the plane. And when I got to Switzerland, I arranged with the hotel to have a doctor to come to my room. And he actually examined me in the hotel room, which was a blessing. I did pay out of pocket for that. I did have some medical coverage, but it didn't cover that. I also got I'll have to, I think it's MedJet. I got a medical policy specifically for that trip, but it actually was for an entire year and it covered both Carl and I did that as well. And they actually just emailed me the other day and said, your MedJet's just about to expire, but it was only $150 per year. And it had quite a lot of coverage. One of the things that we liked about it was in case of an emergency, they would fly us home, which was something, just in case if we needed that. We didn't need it, thankfully, but we got that. And they also gave us bag tags that went on our personal items in case we needed it. We had all our insurance information as well.
One thing I would add to what Angela said, the MedJet program is a good one. There are a lot of those programs out there. Redefine print because in many cases they won't take you home. They'll only take you to the nearest country where they feel you can get appropriate Medicare.
Yeah,
another thing I would point out is that anybody who carries an American Express card, check with American Express customer service because I found out in my travels internationally, I also got sick and I called Amex and they arranged for a physician to come to my hotel room and to take care of me. And Amex, they were allowed to, in this particular case, the doctor accepted American Express's payment. Not all of them do, but that is one thing that they will do. Hotel concierges are generally pretty good in having the names of physicians that the hotel will use. Some very large hotels have hotel doctors who are on contract to the hotel, and they will come to your hotel room and treat you. And in some cases, the charges can be posted to your hotel bill. So, yeah,
Richard had a
medical
question.
coverage. Yeah, just 1 second. The medical coverage in countries overseas runs a terrible gamut. There are countries that you at least have the best medical coverage, but if you're on Medicare, you have no international coverage.
Right.
So be sure before you travel to buy travel insurance that includes medical coverage, or you're going to be totally out of pocket. And a hospital stay overseas can be extraordinarily expensive, even by comparison to US costs. Go ahead, Nancy.
Richard had a question. He's had his hand up.
Yeah, just to follow up on the medication. As close as Canada has a very restrictive list because I also travel with a disabled dependent who has a host of medications that are on that list, and I'm in the process now of trying to sort out which ones are require what type of justification. But in what I found out so far, you need a prescription from the doctor. You need the medication in the original bottle. You can only take the amount of medication you need for the period that you'll be in the country. So even if you're going just to Canada, you need to check that very closely.
Yeah, it's a real problem, and to be honest with you, travel agents should be warning you about this when they book your trips, and many of them are unaware of it.
Hmm.
Thank you, Richard. Thank you for that comment.
Other
Anybody?
questions or comments anybody has?
Go ahead, Carl.
I'd also suggest when you travel to take it, get a letter from your doctor. It says you have Parkinson's disease and you're actually and even lemonade didn't take it with you to show just whether you need it at the airport. You need to show first responders or but have that paper.
Yeah, not only, Carl, does that letter say that you have Parkinson's, but we also listed some of the symptoms that Carl's Parkinson's has, particularly dyskinesia. Because sometimes when you're in the security line and you have dyskinesia due to stress, you may get, just like Carl's doing now, you may get have all this involuntary movement, and you don't want to be flagged because you have some involuntary movement that looks like something else. So yes, we did travel with the laminated letter from our doctor. So that came with us as well.
There is also a program known as the Sunflower Program, which is known more overseas than it is in the United States. It's a program by which you can get identity tags. You can wear a lanyard. It's loaded with sunflowers, which is evolving to become the international symbol for hidden disabilities. Parkinson's disease can be a hidden disability unless you're in the middle of a major dyskinesia, but more and more countries are beginning to recognize it, and so they have ID tags that you can wear with a lanyard around your neck. You can look it up. They are.
I just put it in the chat, David.
Oh, okay. Okay, fine.
Yeah.
Angela has put the link to that program in the chat.
Yeah, if you don't have the chat open, it's HD, like hidden disability, sunflower.com.
Now, Carl's recommendation and Angela's comments about the laminated letter from your doctor. The other thing that the doctor can put on it, even though it doesn't count as a prescription, is to put the list of prescribed medications, dosages, and the times that you should be taking them. So you have a single document that's got everything, including your physician's signature, and you can take it with you. Sometimes public officials and hospital officials in foreign countries will recognize this as being very important.
I'll also mention that I did do Medic Alert for a bit. I have to renew actually, but one of the things I listed is one of my conditions was actually that I was a care partner. I don't know if anybody, in case there was an accident where I was unable to tell anybody, what the situation was, I wanted them to know that I was a care partner too.
Yeah, there is a program, I think I remember reading about, but I have no firsthand knowledge about care partner identification, where there are two IDs. One, the person who has the medical condition, and the other is the care partner. And they're linked together. But I don't know if that program ever got very far.
We'll have to look for it, David. If not, we should start one.
It's a possibility.
Anybody else with any comments or questions?
I just wanted to say thank you. This has been really, really helpful for me.
It is our pleasure.
Hope you have a great trip, Marcia.
Yeah, thank you. We're going to Australia, Japan, and Vietnam.
Oh, wow.
I can tell you that all three of those countries have medical restrictions.
Oh, okay, I'll look them up. Thank you for telling me that.
Arlene?
One of the most obvious things don't pack all of this information that you have to carry in your luggage because it's easier. Just buy a bigger purse.
No, actually, Arlene, I'll take that one step further. Put it in both places.
Yeah,
You
but I
should,
mean,
the
don't,
information, the paper information should be both on your person and in your packed luggage and with your care partner. So you got 3 places to have it.
And I will say, Marcia, having gone to Europe, a few months ago, about a year ago, for almost a month. Pack as lightly as you possibly can. Take necessities, but be frugal.
You know,
That's what I'm planning
I will
on.
tell you from the perspective of somebody who used to do 280 days a year on the road, typically in 30-day increments. It's sometimes worth paying the fee for the laundry service at the hotel to lessen the amount of material, clothing that you take with you. Because packing lightly with the gorillas that handle your luggage internationally is very important, because if your suitcase is packed heavily, they'll throw it. It'll get handled last, or something will be damaged inside when it bounces. The lighter you can pack, the better off you are. And hard checked luggage is always better for international travel.
Mm.
Soft carry-on, but hard checked luggage.
And I'm also thinking to take all of my meds in my carry-on.
Always,
Yeah, okay.
always. And when you're going through security, if you have a lot of medications, let the TSA agent know that before they scan the medications, that there are going to be a lot of medications in there. Give them some kind of Parkinson identification or your doctor's letter, so that you can try and avoid an unnecessary secondary screening.
Okay, thank you. Sure.
Marsha, I'll also make a pitch for when we did our 3-week trip to Europe last year, we used a travel planner, and she arranged for us to have escorts at every airport, so that when we went through customs and immigration and all that, it was smooth sailing.
Mm,
It absolutely, I know how much it cost? No, because it was part of a whole, she just basically gave me a total and whatever. But even in the UK, they have like little scooters that once we sat in it, we never got up until we got to baggage claim, and they ran us through the whole entire customs process and immigration and everything, and we sat through the entire thing. It was amazing.
okay.
But it was well worth it, because we just sailed right through.
It was stressless, yeah.
Yeah.
Yeah,
Okay.
there are a lot of people with disabilities who tend to want to avoid wheelchair service. And I can tell you, especially in international countries, UK among them, wheelchair service is critical, because if you're in a wheelchair, they take you to the front of the line or to a special line for security. They're supposed to do it at Dulles. Depends on whether or not you get somebody who knows what they're doing.
Mhm.
And TSA pre-check, if you're going through a TSA pre-check spot, make sure that the pusher takes you to the line with multiple agents, and some of them will actually take you to the front of the line. I suspect, Angela, if you had the concierge walking you through, she may have enrolled you in Clear. And that's a service they're supposed to do. Or there are other services in international airports where the airport actually offers the service.
Yeah, the UK was incredible. They really were on top of it. So much that I think Carl only walked from the plane up the ramp, and then they immediately made him sit. They insisted he sit in a wheelchair or in the little cart, the little motorized like an
Yeah.
upgraded golf cart thing. He
Mhm.
didn't stand up till he got to baggage claim.
They wouldn't let
He's
me.
like, I can walk, and they're like, no, just sit down.
I had the same thing. From our last trip to Israel. We had to go through Heathrow, unfortunately during the strike.
Oh,
other questions or comments? Don't everyone talk at once?
Mhm.
I will share a quick story that I found out from a friend who's actually on the screen years ago, who commented about having to educate the nurses time and time again at every nurse's shift about Parkinson's meds and all that. You might be on the repeat button if you have to go in for a procedure, or maybe you've been admitted. Don't be surprised if you have to continually repeat yourself talking about the medications, the way your personal loved one responds to the medications, their particular symptoms of the disease, because probably when they don't know the rule that when you met one person with Parkinson's, you met one person with Parkinson's. And most nurses do not have extensive training in Parkinson's disease. It's just not covered very well. And that includes some physicians that are there, hospital generalists may not have extensive training, maybe 1 day of training in neurological diseases like Parkinson's. So if you feel like you're repeating yourself, you probably are, unfortunately.
Mm.
Yeah, I've seen someone put a sign above their bed, I have Parkinson's disease.
Ruth Ann, did you want to make a comment?
Yeah, I was just going to say it's been a number of years since Bob was around and we traveled. But I can tell you, I had a reputation of not backing down to a nurse who said, "No, I have to do this paperwork before I give him his meds." And there were many times that I just had to stand up and say, "No, if you're not going to give them to him, I'm going to give them to him." "Well, you can't do that." I said, "Watch me." And, so, I think, and looking back, sometimes I think I probably was a little ruder than I needed to be, but it's amazing how people get into this routine. This is what I'm supposed to do. I'm supposed to record this, this, and this, and then we'll look at your medication. And it doesn't work that way with Parkinson's. And the other place that was always a challenge was going through the emergency room, because the technicians there truly don't have a clue what Parkinson's is. And we had one physician come in and took the technician to task because he was trying to tell Bob to lay still so he could do something for him.
Mm.
And the doctor took it upon himself to explain to him in no uncertain terms, when you have Parkinson's, you can't necessarily control these things. So, emergency rooms, I think, can be just a real bear if you have to go in there.
Mhm.
So,
Yeah, something that you may wish to consider when you're with the triage nurse in an emergency department is to tell the triage nurse, to tell the senior attending in the ED that you are a patient with Parkinson's disease, so that at least the physician is alerted, hoping that the senior person is aware of what they should be, but you never know. You really never know.
Well, I always say one of the most dangerous places to be is the for Parkinson's patient is the emergency room.
Yep.
Yeah.
Yep.
I'll also make a pitch. If you have a scheduled procedure, please repeat the fact that you have Parkinson's. Even if you're in for a scheduled procedure with Parkinson's, there are times, I had an instance where I was a advocate for a friend who had Parkinson's, was going in for a deep brain stimulator battery change, and standing next to him in the pre-op room, and I turned to the nurse. They said something, I can't remember what it was, but I said, well, you do know that this gentleman lives by himself. So if you release him today after his anesthesia and with Parkinson's, that's a fall risk. And you may want to consider him staying overnight so you can monitor him coming out of the anesthesia, because I don't live with him and I don't assist him at home. And they did not know that, even though he was a long-term patient. So even something as simple as somebody living by themselves with Parkinson's may be a concern. So highly recommend you repeat that as well.
The other thing is, no matter how many pieces of paper one fills out, and how many people ask you the same question, somehow or another, it's not really a criticism, it's just a fact. there's a disconnect along the way. You can tell somebody 10 times, frankly, it could be Parkinson's or some other medical issue, and they ask you the same, every person you see asks you the same question, but they don't seem to always process the answer you give them, and you cannot be assured that nurse number 1 passes it on to nurse number 2. Forget nurse number 3, 4, or 5.
Mm.
So repeat, repeat, and repeat seems to be the one mantra that sometimes works.